Let's take our time and work through this together, step by step. We can approach it patiently and make sure we understand each part as we go along. Hello everyone, dear friends. Welcome to our channel. Today we have a patient with us. Her name is Kira. Kira, tell us what brought you here.
I'm really troubled by pain in my thoracic and lumbar spine. It pulls so much that sometimes it's hard to walk, and even my shoulders hurt by the end of the day.
Here's a question for you. How long has this been bothering you? And in general, what do you do? What could be causing it?
Well, the pain in my thoracic spine has probably been bothering me since puberty because my chest is large and it's constantly pulling. Plus, since childhood, I used to slouch because of my height. And later, I started having problems because keeping my back straight all the time is very painful. And now my breasts have become even larger due to surgical reasons, and this puts even more strain on me. And I get tired much faster. It is much harder to keep my back straight for a long time.
Clear. And let's go back to our puberty period. You've started experiencing discomfort in your spine. What measures are you taking, or are your parents taking any measures?
I was at the sanatorium, which I visited quite often as a very frequent guest. Massage.
We're the only ones who need to explain ping to our viewers. I constantly explain this because, yes, we have an emphasis on manual therapy, but manual therapy is my personal opinion. It should be combined with therapeutic exercise. Why is this all because of manual therapy? I speak specifically for my technique. When we stretch or elongate, we need to stabilize. Stabilization is achieved only through therapeutic exercise. There is no other option. There simply isn't, and there won't be in the near future. Yes, there are physiotherapy devices, no question about that, but they also don't provide stabilization. This needs to be understood. So, Kira, you joined us at just the right time, so to speak. Did it help?
Yes, it helped. Right before I had breast surgery, I spent a whole year preparing because I knew the implant would be placed under the muscle. And I hired a special trainer. She spent an entire year preparing my back and chest muscles for this. And I felt that everything was going really great. And then I got the implants, had the breast surgery, and basically got scared. I quit for a long time, stopped going to the gym. And now I do yoga. It helps me a bit, but the fatigue after holding my back all day, it still lingers. It doesn't cause a lot of pain or discomfort, but afterwards I literally end up lying down with some kind of massage device, whining half the night.
Well, that's the situation. All right, let's do this. We'll examine you while standing first. We'll check you in a standing position because that's when there's axial load. When you're standing, there's tension. We'll see what's going on. Then we'll move to the couch. You'll lie down. Your muscles will relax and calm down, and we'll palpate and see what's happening in that unloaded, non-weight bearing position. After that, we'll do a bit of massage, some people like that, and then move on to manual therapy itself. Maybe we'll even see something that points to therapeutic exercise. Dear viewers, I ask you to stay until the end and watch this video. Subscribe to the channel if you'd like to book a session. The number is also at the beginning of the video. We also have websites listed below this video as well as other platforms. Alright, let's move on. Dear friends, let's proceed to the standing examination. I'm not sure if it's visible or not, but there's a slight rotation. We can see it. The patient is standing a bit like this. Take a deep breath in, exhale, and relax. Relax your shoulders too. There are definitely plenty of trigger points here, Kira, as you can clearly see. That's what I was taught to do. Good. Now let's go a bit lower. Let's bend the torso, let your arms hang down around your spine, lower your head even more. Overall, it's symmetrical, nothing alarming here. Let's come back up. Now let's move over to the couch. We'll proceed with the examination and palpate the lumbar region. What does that mean? Well, I can feel the tone. but it's not so bad that it's unbearable. Trust me, it won't hurt that much. But here there's hypertonicity. What year was the surgery? 2022? Alright, let's move on to the massage now. First, we'll gently warm up the area, making sure the muscles are relaxed and ready. Then we'll carefully knead it, applying just the right amount of pressure. So stay tuned. So dear friends, we've now completed the massage and I hope you found it relaxing and beneficial. There will be some minor restrictions due to the surgery, but we'll work on the lower back and relax it. Don't help, just relax. Relaxed. Everything's fine. All right, look, let's just move a little bit over here. It grew. The chest, how is it?
Even higher.
Is it not allowed or does it hurt? What?
It's right between the chest and...
All right, then let's stretch here right away and gently relax your shoulder. In this position, you can stretch both the shoulder and the chest area as well, allowing your upper body to open up. Now let's slowly move to the other side. Similarly, just relax now. I'll show you that without the towel, did you see there was absolutely no discomfort or pressure at all on the chest? That's good. Come closer to me. It's okay. Nothing to worry about. Turn your torso. I'll do it this way too. The chest is a bit full, so we'll stabilize it, so to speak. Hold it with our hands. You need to turn to the other side, just like this. Not like that. This position is fine. As you turn, remember to relax your pelvis. Try to move gently and steadily, making sure your body feels comfortable as you turn. Pay attention to your posture and keep your movements smooth and controlled. All right, everyone, if you would please sit down now. Not like that, I understand. Sit a little more to the left. Now we're going to stretch the thoracic region. This is also an important point. Listen to the patient. So that there is no discomfort or uneasiness in the chest area, gently place your hands behind your head and carefully lock your fingers together. This will help you stay comfortable and maintain proper form during the movement. We ask the patient to bring their elbows together. Lie down on your back. Now let's return a bit to our thoracic region. Since there are certain limitations when lying on the stomach, we place the left hand on the right shoulder. Like this. And just like that. Relax. That's it. Turn onto your left side and from your left side sit up. Not quite right, but still. Okay. All right. How are you feeling? Take a deep breath. What's your height?
Let me tell you just a little bit more if you are interested.
If you were 5 centimeters taller, you'd catch up to me. Well, volleyball.
Exactly.
All right, relax. We'll move on to your neck now. Tilt your head.
Oh, Mom, I'm really scared.
It's nothing. See, that's all there is to it. Tilt, relax. Lay on your stomach. Are you in position? Okay. Rest your chin on the floor and keep your arms along your body. Move your hair aside a little. Now we're going to do a lateral stretch for the cervical spine on the slide. Good. Was there something you wanted to mention or talk about? Okay, please turn onto your back for me now. Now, our highly respected Antoine will lie down on the legs and we will perform decompression. You could definitely call it that as well. Let's move on to decompression, Antoine. Don't overthink it.
Seriously, one man is actually lying right on top of me, and another person is firmly holding me in place. In
In our time, this is called decompression.
and in your time,
For us, it's just relax. Let's get back to it. Are you ready since you're lying down? Let's take a look at the hip joints. I don't examine men's hips as often, but I can do it. We don't work with men's hips as much as with women's because, again, it's different. Completely relax your leg, let the weight of your leg go. There won't be any manipulations here. If we are unable to come to a mutual agreement or understanding, then as a last resort, we offer a bribe. Just kidding, of course. That doesn't work when we start working. Same with the other leg. By the way, all of this stretches better. Turn over onto your stomach and get up on your elbows. Bring your elbows together, hold them. And what is all this expensive? Elbows together. Great, now let's work on the thoracic spine as well, also known as the mid-back. Well done, you made it through. So are you with us?
Region 23, located in.
Come on, stand up. Basically, Kira started off correctly. Come over here, hide. You started correctly with therapeutic exercise, so that's your foundation. That's basically it for today with Kira. Further recommendations will follow, some of them off camera. Kira, your turn to speak.
Thank you very much. My neck feels much better now. It's like a heavy load has been lifted. My shoulders feel a bit lighter too. It was scary. But honestly, it's not as scary as it actually feels. So, for those who are afraid, in my opinion, you just need to breathe. Especially women who've given birth will understand. Breathe, relax, trust your doctor, and then the procedure will go as smoothly as possible. And
The chest is still in place.
yes, even for women with breast implants, the qualified and experienced doctor will carefully choose the right exercise or manipulation.
Exercise as well, by the way.
Exercise too, yes, so that the load is correct and there's absolutely no unnecessary strain or pressure on the implants.
Let me clarify a bit, actually. Here we were talking about aesthetics. I understand a child was born.
I breastfed for 2 years and it was right here. Women who haven't given birth, you don't need to do this no matter what anyone tells you.
Olya, by the way, let me add about having a full bust. There's a lot of strain on the thoracic spine. Everyone with a size 4 or larger definitely has some issues with their thoracic region.
After giving birth, you put even more strain on yourself, plus you're carrying the baby.
And then you have to carry the child as well. By the way, yes, that's also not easy. Let's not forget about that. Giving birth is one thing, but
You end up carrying them like this.
feeding is really another matter, and caring is a third. No husband will do all of that for you. Be sure of that.
No, definitely not.
Well, thank you all so much for taking the time to watch this video, and I hope you really enjoyed it.
Thank you. I feel good. It's great to be back on deck.
By the way, sometimes it felt like I was about to fall, but we said where the keys would be, so,
Everything turned out absolutely fine, as you can see. I'm smiling.
no tears. That's it, Care. You've leveled up.
So much.
It's time for all of us to scatter around the house and finally spend our only day off just lying down horizontally. Thanks everyone for watching. Don't forget to subscribe. See you next time. Bye.